Good morning. Now present the term film skin syndrome.
Hi, my name is Kayla Navarro, and I'm gonna start speaking about peeling skin syndrome. This is a group of rare autosomal recessive forms of ichthyosis, which is a group of disorders characterized by superficial, spontaneous desquamation of the skin and histological by outslotting of the outer layer of the epidermis. It is caused by a genetic defect in the corneodesmosine gene, and this gene is located in the human epidermis and other epithelia. There are two types, which are type A, characterized as non inflammatory, and type B, which will be inflammatory. It appears for birth or early childhood, which the formation of blister and subsequent localized desquamation on the palms of the hands and soles on the feet. Most of the time, it presents with little or not clinical manifestations, which together with is no low incidence because it is be under diagnosis or misdiagnosis as epidermolysis bullosa simplex, which is a different disease with which it shares some characteristic. Unfortunately, auto treatment of this disease can help. There is no cure for this condition.
Hi, my name is Marcos Pucon. Now we will talk about symptoms and signs. The skin anomalies manifest at the birth or shortly thereafter. Patients show painless, widespread superficies, and asymptomatic and spontaneous feelings. Feeling of the skin consists of exfoliative with the flakes of variable shape and size that develops in the middle erythematous denuded areas, with the feeling boards, palms, and soles are sparse or may show redness and middle skin thickening or hyperlinearity and underlying erythema is present to seasonal of variants are generally observed. Pruritus is frequent and often severe and is exacerbated with warm temperature. In most cases, hair can be easily bucket, hair and charring deficit, mild to moderate nail change are something. Report of koilonychia, onycholysis, thickness, yellowish appearance, atopic manifestations are frequent. Uh, Example, food allergies, episode of angioedema, urticaria, and asthma. And Staphylococcus aureus skin infection are reported. Patients are usually in good general health but may present with mild failure to thrive.
This condition is caused by a mutation in gene that controls the bonding of skin layer. Some possible causes of peeling skin syndrome may include genetic mutation. Most cases of peeling skin syndrome are caused by genetic mutation that affect our skin layer adhere to each other. Autoimmune disease. In some cases, peeling skin syndrome may be related to autoimmune disease that affect the immune system and can damage the skin. Exposure to chemical. Exposure to certain chemical can damage the skin and cause the appearance of blister and peeling. Infection. Certain infection can cause an inflammatory response in the skin, which can lead to peeling and blister. Liver and kidney disease. Some liver and kidney disease can affect the skin and cause excessive peeling.
Hi, my name is Boris Nufio. I'm going to finish in this presentation talking about differential diagnosis. There are some types of disease that can be similar in symptoms, like in this syndrome. I'm going to talk about exfoliative dermatitis that is accompanied by distinct rendering. The other one is keratolysis exfoliative congestional, that is limit to palms and soles. And the last one is Netherton syndromes. These syndromes is a rare type of autosomal recessive congenital. So there is some types of disease that can be similar in like peeling skin syndrome. Thanks.